Okay, and we are live.
Yes.
Hello, everyone. I am Dr. Katrina, as most of you know me. I'm the chiropractor at Oak Tree Health in Orleans. And today I'm here with Anik Lalonde. She can tell us a little bit about herself.
Thanks, Katrina. Hi, my name is Anik Lalonde. I'm a physiotherapist, currently working out of two locations, one in Orleans, MotionWorks Physiotherapy, and then my own home business in Rockland called Anik Lalonde Physiotherapy.
Awesome. So Anik and I originally connected through a mental health collective because body and mind, they're kind of one and the same. And we've been kind of networking and referring some patients in between since. And this month, it's pregnancy month at Oak Tree. So I thought, it's the best time to really be able to connect virtually, which is really cool over Zoom, and to kind of answer some of your guys' questions and concerns, and just give a little bit more information on how we can work together, but what type of services a pelvic floor physio may offer, not just during pregnancy, but postpartum as well. I've been talking postpartum support with acupuncturists and naturopaths, but I really wanted to get a sense of what a pelvic floor physio does, because they offer specific exercises and examinations that I myself cannot do, but I know it's part of an integral team and examination. So during pregnancy, what would you say some of the common things people come in with during? Is it just a preparation or?
I think we're still in a phase of patients coming in after the fact. Like, our healthcare system in time will catch up. We are seeing this sort of uphill slope, or this slope anyways, of more and more client progressively coming in the before period just for a checkup. Like, I want to know how I'm doing, how I can better prepare for delivery, that kind of stuff. But that really isn't the majority. If I see somebody before labor, it's typically if they've been experiencing low back pain, SI joint dysfunction, pubic symphysis dysfunction. Other less common ones, maybe swelling in their extremity due to the pregnancies, pain to like round ligament, stomach stretch, and that kind of stuff. So those would bring people in, and then I have the conversation with them about, hey, I'm also, this pelvic floor therapist, and I promote prep, labor, and delivery type of work. So to discuss a little bit more about that, I'll take a few seconds there. Labor, prep, and delivery, essentially, let's avoid tearing as best as we can. If you have a tight pelvic floor, if you have restrictive tissues in and around the opening, there's stuff that can be done early on that doesn't have to be the invasive tissue stretch. In fact, I teach a lot of pelvic lengthening through breathing, work with some yoga tune-up balls. So that you can start putting into practice as early, I'd say, as 6 weeks previous to your expected due date. Otherwise, I talk a lot about what you can expect right up to your delivery, and then what you would do right after delivery, because I don't typically see people for the first 4 to 6 weeks unless there's something that needs to be addressed. They have symptoms, but then I've already given them the education about, here's what to look out for, reach out if you have this, otherwise I'll see you at 6 weeks. Here's all you need to know for those first 6 weeks.
Yeah, and the education side is really important, because it's good to know what's kind of normal with pregnancy, postpartum, and what differentiates when you should be seeking out a professional. The yoga tune-up products, I love to use them as well. In terms of preparation, would you say that when someone comes in and you're doing perhaps different breathing exercises or different stretching, do some of those exercises roll over into the postpartum period?
Well, what's funny that you ask, what is a perineal release for labor prep becomes your scar tissue work after, if you've had any. And I mean, even if you haven't quote unquote torn, the tissue of the perineum and the vagina, they're accommodating, but they're only so accommodating. So there will be micro trauma. To the naked eye, you don't see that. It doesn't require stitches, but you should still be promoting good tissue healing. So doing any kind of friction, ball release, some light stretches through those tissues helps the tissue heal better. Those new fibers that are considered scar tissue or scar fibers have a chance to realign and that becomes sort of your new you afterwards as well. So you are repeating some of the same exercises, pelvic floor stretches, and Kegel postpartum. We could talk about that a little bit further along, but you don't have to be worried about stretching the pelvic floor postpartum so much. And I don't want to get too deep into the physiology of it too, but what you want is enough stretch of the pelvic floor so that you're letting your muscle fibers know that they're healing, and you're creating more build of your sarcomere and that anyways, new tissue growth. Geez, I haven't worked enough lately to keep up my terminology. Getting rough.
I know exactly what you mean, and I like how you put the emphasis on healing, not just strengthening or postpartum. A lot of people, or you'll just see it online, like the bounce back or the tummy tuck, and as though it's normal for things to just look normal. But a lot of the healing that has to occur is something that's not there for the visual eye to see. There's tearing the perineum, especially if you had like an episiotomy. That's definitely probably one thing that people would tell your medical doctor, your OB would tell you to go see a pelvic floor physio, right? But even like C-section scarring, it heals to an extent at 6 weeks, but there's actually like communication and nervous system that happens through the fascia. Like when you have a C-section, you're cutting through like 6-7 layers of abdominal tissue. And on the outside, it might be a scar that appears healed, but if that tissue doesn't rehabilitate, you're not going to be able to generate that core stability or kind of like abdominal pressure to protect that low back.
Correct. And just to circle back, I mentioned stuff about stretching. So there's a difference in the type of stretch that you provide from a light activity, like let's say a child's pose or a cat-cow. Those are good mobility exercises for your pelvic floor, and they're not overly stretching the pelvic floor. What I don't want people to think is things like, let's say, deep weighted squats right after birth. They're not quote unquote wrong. Heck, you have to be functional. You have to be living life and caring for your baby. So you're going to be lifting some kind of weight. But there's a timeline to allow that kind of load and that kind of stretch to build back up onto the pelvic floor. So to circle back to your question is what exercise transition between before and after? Well, I'll give you pelvic lengthening exercises before for obvious reasons. Your baby has got to come through. And then those same stretches are light enough and gentle enough that they provide that nice eccentric load or that nice sort of tensioning, telling the body we need to rebuild these tissues. Here's the load into the tissue needed for the brain to know it needs to build back up. So
yeah, I know I've seen some exercises where it's like you're even just like sitting on a yoga ball, like one of the big ones, and you're practicing different stretches and releases through there. And I know like with chiropractic, that's one thing that I can do is I adjust the sacrum and the pelvis to make sure the bony alignment, like you mentioned, SI joint pain, pubic symphysis pain. So I work more with the bones and the joints to ensure the best size of that bony pelvis for delivery. But you want to make sure that those muscles are able to stretch. So just like rehabilitating anything, you haven't given birth, got into delivery yet, but just like you would train for any event, it's like the most physical event you'll ever go through. Like it's amazing. So it's good to stretch those tissues. Is there ever a time when you do an assessment where it's not necessarily stretching and release that's needed, but there might also be some tight pelvic floor muscles, either pregnancy or not, that they might benefit from that too?
I'm not sure I got your question, because if there's tight muscles, we're definitely going to be talking about some form of release. But if I understood your question correctly, would I ever give something other than stretching?
Sorry, is there ever like a soft tissue release you would need to do by hand, perhaps, that's not just stretching for delivery? Like maybe someone before they even become pregnant, they have a lot of tightness in the pelvic floor that could be worked on when they're planning to conceive.
Oh, we could open up a big giant conversation here. Just to keep it sort of straightforward, tightness in the pelvic floor in, let's say, a pre-pregnancy scenario would look something like, that person's got either hip pain or low back pain. They had, urgency type issues with their bladder, like something for me to know, like you have a tight pelvic floor. I don't even need to touch it to know. then we're definitely going to promote some good mobility in through there, simply to promote or facilitate fertility as well. Like if things are tight, it's even that much harder from a fertility standpoint. But then going forward, I never really, people don't know, they don't come in saying I have a tight or weak pelvic floor. They've assumed because they've read, what they've seen, right? So I don't tend to do as much hands-on release as I used to, simply because I want to build that person's self-efficacy. There's good ways of either changing your routines, your postures, breathing, that kind of stuff that'll have a longer lasting effect. Not to say that I won't do a few releases so you get the immediate benefit, and then kind of go on that way. In a late term pregnancy, so we're talking third trimester, usually 6 to 8 weeks expected delivery date, that's when I'm going to be doing a lot of manual release if things are visibly tight. Because we're on a short timeline. It's okay, there's 8 weeks. Put the pedal to the metal, let's stretch out the opening so that you have less chances of tearing. So then I throw a little bit more emphasis on manual release.
No, and I love what you just said in regards to like building self-efficacy, because especially like a postpartum, if maybe they're not coming to see you for like 5-6 weeks, as you mentioned, a lot of what maybe they learned before when they were pregnant can be tools that they continue to work on, and exercise that they can continue to do at home up until they come in, even if it's just something like breathing. Like that can work. That can work really well.
Yeah.
So 6 weeks postpartum, you mentioned that a lot of it's from kind of like your history that you're able to deduce, I guess, a lot of what's going on, and you don't always have to do as much hands-on release. What type of questions or things might you ask postpartum?
I mean, again, trying to keep it straightforward. So if I've seen the patient before delivery, then I know quite a bit of their history. If they're new to me postpartum, then I take still a full history, which will look like, well, what symptoms are they complaining of or currently experiencing? Frequently at that time postpartum, we're talking about their scarring, we're talking about any kind of incontinence, any pressure type feeling. So whether that be lower down in the belly or that feeling of something dropping in the vagina, that I mentioned incontinence already. And then definitely talking about exercises. I can't even count on my fingers how many times people come in and it's some of the first words through their mouth. I want to get back to physical activity. Cool. Me too. I'm on board. We'll get you there. And I'm the clinician that's going to support your goals. You want to run? All right, let's see how we're going to do it. I'm going to empower you. I'm going to basically look at what it is you want to achieve and what's a reasonable timeline. I had a patient that wanted to run a full marathon at her 9-month, well, her marathon was scheduled for 9-month postpartum. And she saw me at 2 months with incontinence at 500 meters of running. I said, okay, if you're willing to do this my way, we'll get there, but you got to do it my way. Do you agree? And she said, yes. So by 4 months, she was running 10K by then completely dry.
Yeah.
So it's not to take her out of it, right? It's to basically show her how to get to her goals.
Yeah, and a very stepwise, like safe way to get there.
Yeah. So
it's
too often some of us, sorry?
I was gonna say it's not a rush to be able to get there, but you can.
Sometimes less is more, right?
Yeah.
Because if you load too much your body or your pelvic floor, whatever it may be, and you actually get into the deficit, it's going to be so much longer to get yourself back up here. Whereas you may as well just start up here nice and progressively and meet your goal.
Yeah.
I think too much clinically, like either be physiotherapists or athletic therapists, personal trainers, we tend to say you've had a baby, you're postpartum, you're this, you're that. Like, you're still lifting that baby, you're still running after that toddler, like you're still being physically active. So it's not to take you out of it, it's just to show you how you can put your best foot forward and follow a nice progressive return.
Well, I think for sure for athletes it can be tough, because you wouldn't have thought necessarily like doing the laundry, bending over, picking up your baby were particularly athletic activities, but postpartum, when your tissues are healing, that's the thing, they are. So that's why strengthening the core and the pelvic floor before you do any of those things is important. Like one good test is like if you want to see if you can, jog, let alone run, go out for a walk for 20 minutes. Go for a walk, see if you have any leaking. Then, go out carrying baby, right? You're going to want to be spending time with them anyways, of course. Well, you don't really have a choice, but you're going for that like 20-minute walk, and that should be a baseline, and gradually pick that up every day and see
Right.
how far you can go.
And as I tell my clients, time is on your side. Like, time will heal. Give it time. It gets better progressively and continuously, especially if you're that early phase postpartum and you're like, oh my God, it's not like it used to be. I can't do this. I can't do that. Oh my goodness, it's changed. Like, you put 9 months to change your body. Give it a little bit of time and it will bounce back. But my heart goes out to those who come in and, they're really adamant about going back to a certain physical activity on a specific timeline. I'm right there with them. I want to support them to the best that I can. And that's becoming more and more common. Like, women do want to get back to their physical activity right after. So again, educating on how they're going to do that and not telling them no, because part of it is, their mental health and their, I need to get out of my bubble at home and do something that's for me, or whatever the reasons may be. So,
well, that's like you highlighted the mental health. That is as much of an importance as the physical, because they don't only want to get back to exercise because it's physically good for them. That's part of their identity. So even going back to work, depending on what your job entails, like our jobs, for instance, there's a physical aspect to that. So there needs to be proper time and rehabilitation and healing to allow that. So of course, there's things like rest, sleep is going to be really important. I let a lot of my clients or patients know about heat, because heat's going to promote blood flow, micronutrients, tissue healing. Is there anything else other than exercise that you might go over with someone postpartum just to promote that healing further?
Good nutrition?
Yeah. And I know we're not holistic nutritionists or something, but are there maybe a couple main things or tips you might give to someone based on their goals? Or
that's another can of worms that we can open. I don't dive into too deep nutrition. Again, I'm not a nutritionist. And from a college standpoint, we have to have shown that we've taken some furthering education to be able to talk about it, which I have some, but not to the extent a nutritionist would. So I would refer out if there was a clear deficit, whether it be hormonal or vitamins, so on and so forth. But, even just discussing the fact that your body is in recovery mode and it needs to recharge the battery. So that means good food, good sleeping. And what's the number one thing moms don't really have postpartum? Time, right? It's all devoted to baby, but you're no help to baby, or you can't be your best self to baby if you're not recovering and recharging as well, right? So it's such a broad sort of spectrum, or like it's so intertwined.
yeah, no, and I like that you said you take that individual approach and you ask them what their goals are, because part of seeing you or seeking out any health professional is their opportunity to put themselves first. And, healthy mom's going to be a healthier baby. We do all these things to promote sleep. We're not sleep specialists, but something as simple as, getting the baby on a sleep schedule, if you can have those same rituals for yourself, turning off the phones, drinking water, maybe taking magnesium, those types of things so that they can get a restful sleep too. And then in terms of nutrition, I just touch on basic things like, tissue healing. Are you having protein? Are you having things that have collagen? I'll talk about different things like bone broth and stuff. And again, like you said, it's a whole other can of worms, but you mentioned like the hormonal change, even for mental health. Things like, are you having your omega-3s? Are you taking probiotics, or are you sourcing those in natural foods? So natural is always better, but
then you think of all this sort of meal prep and planning, and I have to catch up on sleep. I have to feed baby. I have to sanitize bottles. I have to look after the toddler. I have to do laundry. I have to sleep. So we need to kind of slow down that cycle and slowly but surely give them tips on how things can kind of line up, right? It's not going to all be done at once. It's not going to all be perfect. And not everybody has the same needs. So it's kind of listening to, like you said, people's own stories and really kind of picking up on those few cues. Okay, this is really what she needs work on, or the areas that, can change a little bit. And we're really there to advise and, be sort of a coach, not to tell you what you need to be doing and how you need to be doing it.
No,
So.
and there's a lot of resources, especially online right now, like yoga, and you mentioned stretches like the cat cow or cat camel, child's pose. Those are all things that are also prevalent in things like yoga. Deep
Mhm.
breathing, which again helps to strengthen the diaphragm. Close if you have any kind of separation or diastasis, recti, strengthening the pelvic floor. And those practices, they're worldwide. Like breathing, it's not just for the physical health, but you just mentioned everyone's like, I need to do this, this, this. How do you slow down? So even taking just 20 deep breaths a day, going for a 10-minute walk on your own, and working on taking those deep breaths and like lifting that pelvic floor. Some of these things can kind of work in together. And if you're doing these, types of exercises or breathing, you're probably going to sleep better too. So you get into this better cycle rather than this kind of negative one.
Right. And if you look at what I do on typical appointment 2 or 3, like appointment 1, I assess, I get to know the person, I ask the questions. Appointment 2, we might be doing a bit of hands-on, but appointment 3, I'm like, okay, time to get up and going and in the gym. And I look at things like how they pick up a laundry basket or how they get up off a chair. It doesn't look like a whole heck of a lot, but right now, how often are you getting up and off a chair? Like 17 million times a day, most of the time with a baby in hand. That's already a weighted squat. If I can show you sort of how to, I don't want to say do it right, but how to basically do it better for your core rehabilitation, your pelvic floor, the closure of your abdominal wall, it's already benefiting you all day long, and you're not stopping to have to do exercise quite yet because you just don't have the time. You're going to put that on like, okay, in a few weeks I'll pick up working out, cool. But do what you're already doing with a hint of physio or a hint of strengthening or a hint of whatever.
Yeah. Yeah, because
So.
you already are doing all these activities. So how can you do something like sitting down or standing up in a more mindful way that it's like you're doing a squat? If they were to count how many times or wear like a Fitbit, like a step counter, they're doing so much already. And in those first like 40, 50 days postpartum, you need to be taking care of yourself and your baby, like these other things. Like you said, the one was 2 months postpartum. Like that's the time you can start that conversation. But before that, it's like just take care of yourself. You're doing the number one job, and that's taking care of a newborn. And that's huge. Like this culture trying to get back to work and do all these things, it can be a lot.
And it's really about meeting moms exactly where they're at in their progress or their recovery, right?
Yeah.
So.
Well, and I love at the start of this, you said how you're practicing on Innis, but you're also practicing, you're going to be practicing home as well. Right now, if someone wanted to communicate with you or reach out, are you doing virtual, like online consults as well?
So right now, yes, I'm doing virtual health. It's proven to work out quite nicely. I guess it's a new norm. I was a little bit skeptical at first, but you develop very creative ways of giving tips and exercises, and you get comfortable in front of a camera. But needless to say, I did a postpartum assessment a couple of weeks ago, and I'm going to back up here for a second, but from taking her history and kind of seeing how things had gone through labor and what her symptoms were, I'm already able, my clinical brain is already kind of in high gear there, making up some differential diagnosis. Like, okay, this could be going on, this could be going on, this could be going on. Okay, cool. Because I can't have hands-on right now, it's like my gears are on like constant drive, right? So when I look at those differential diagnoses, I would do the same in clinic, whether I have you in front of me or not, is basically put the most probable up higher and then it's okay, well, likely you have this, and this, and this, and that. Then we physically assess and confirm or refute some stuff. So we would then, in a virtual health scenario, take the most probable diagnosis and say, okay, well, you're likely experiencing some of this, probably have pelvic floor tightness. Let's work on this. If the changes are so that they're not what we expected, that actually helps our clinical diagnosis, right? This didn't work out. What if we look at this instead of, oh, that's a nice added piece of information. We oversaw that one. Okay. So it still builds the case or the clinical diagnosis, and people have been improving, which is really nice to see in this COVID era. I said it.
Well, and I think like telehealth and the Zoom chats and all that, you said getting more comfortable on camera, I think a lot of this is here to stay. And as you mentioned, like you're sharpening your clinical diagnosis skills. I'm producing more videos and doing more of these chats than I've ever done, but it's resources that can now stay, and your kind of demographic or your geographical footprint, it's not just between, within four walls, you can kind of help and reach everyone. So I think that's what's really cool is some of those barriers to getting care, timely care. You mentioned people coming in even during pregnancy or preparing for labor and delivering as a preventative approach for their health, because all of this feeds into overall health when this type of pandemic's happening, right? It's taking care of yourself is going to be important. So I think it's really cool.
And because so much of it is education based, like it lends itself so well to the platform. I mean, even in a face-to-face appointment, I have an hour assessment and I don't have enough time to say everything I want to say. And I like blur it out so fast. I'm like, tell me to slow down if I'm saying too much, just because there's so much to pack in there. So having this platform is actually nice and relaxing in a way, right? You're in the comfort of your own home. I'm in the comfort of my own home. And sometimes seeing you in your environment or your own, ergonomics, so on and so forth, can tell a lot.
Yeah,
so
and
it's been amazing.
Having the tools that you have at home, like go grab this, try this, and let's see what you have already, because they're home. And like you mentioned, it's flexible. Like this past weekend, I was speaking to a person on Saturday. Yes, it was the long weekend, but there's no really rules or regulations right now. Like if I'm free and you're free, like let's make it work.
What days of the week is it anyways?
Yeah, exactly. Wednesday, Thursday. All right. Well, that was excellent. Is there any other final tidbits or any other nuggets you'd like to add before we close out? But
I feel like we always scratch the surface of so many different areas of all this. I think one of my favorite subjects that we haven't really dove into there is the idea of diastasis, or separating abdominal wall. Again, that can take up another 20-minute conversation. What I'm going to say is, clinically, I think we've kind of demonized the appearance or the diagnosis, if you would, or the presence of diastasis. But what I have to say to those moms who either fear they'll have one or that they do have one, it may not be as bad as you think, right? Get it assessed, get somebody who's trained and working with it. It does get better. So I know it's a lot of information right now because I could talk about it forever, but most people come in and are like, I have diastasis, they're freaking out. I assess it, and clinically, they're good. They just need a little bit of coaching and how to progress from there. But
I know that we could, like you said, go on at length. I know I assess it for the width and the depth, and one of the main exercises is just the breath work and really focusing on tightening in that transversus abdominis that closes. Is there anything else that seems maybe fairly obvious to you that someone else might not know about in terms of like what you should be focusing on strengthening? Or
so we used to address it a lot more about the width, whereas now the research discusses the depth of the separation. So at best of time, if you look at somebody who's never had a baby, there is going to be that small little gap, right? That's where the linea alba, or the connective tissue, is. Anything above that, yes, your tissue is stretched. It also has to do with what point postpartum are you. If you're in those first 6 to 8 weeks, your body is still working at recovering that. So clinically, I do not give a diagnosis of diastasis until at least 8 weeks, because then we'll know what your body has recovered and what's left to recover. And then the depth scenario, well, that's where the transversus comes in, right? Is it tightening up? And I explain the tightening of the corset system, like pulling the drapes tight. So if these are the two halves of your six-pack muscle and your transversus acts well, it'll pull the drapes tight, and you see less of that bulging effect or less of that depth perception. You can have and this is a piece to take home, you can have a separation and still have it be functional diastasis. So if the transverse is turning on, the bulging is minimal. And again, let's not demonize the bulging too much. Too much is not good, but some is just showing that, okay, you're not pressurizing quite perfectly or correctly. But if we go back to our conversation from before, putting a little bit of stretch in the tissue will help our body heal those recovering tissues, right? So that being said, you can have a separation and still be quote unquote clinically functional. Aesthetically, that's a different story. If the aesthetics are something that speak to you, then there can be some work on really approximating that. But I'll leave it at that for today.
I love that too, the closing the drapes. You try to say like a corset or like you're cinching in towards, but I like that. It's such like an easy visual.
Closing the drapes.
But no, I had a patient, she was a medical resident, and same thing, she's like, Dr. Katrina, she's like, do I have a diastasis? And I was like, yes. But we're gonna like see how much. And again, I like how you said, is it functional? It's normal to be there, but are you able to generate that pressure? Are you gonna be able to protect your low back and do all these activities, quote unquote, that require that stability?
Yeah, and I think this is a nice little side story that I often tell my patients just to give them confidence, but you don't have to have had a baby to have a diastasis. Heck, you don't even have to be a woman to have a diastasis. So the story I often use is that of my boyfriend. He probably would hate to know that I'm using him as an example for this, but point being is I was watching him do some reverse crunches in the gym. So I don't know if you're familiar with when you lay on your back, your legs are up and then you get your pelvis up off the floor, legs go up and then back down. So, and he had been complaining of back pain, which I kind of knew it was his SI joint / core. So I'm like, wait a second, pull his shirt up as he's doing his reverse crunches. There's a bulge there. I'm like, yo, you're bulging like one of my postpartum clients. Like, what's going on? And he's like, well, I don't know. I was like, he's a well-trained guy. He's strong in many ways. He knows a lot about a lot. And we've had a lot of discussions on plenty of topics related to working out. But I asked him, I was like, what do you have in mind when I say engage your core? Like, what does that mean to you? He's like, well, isn't it like I'm trying to push out a bowel movement? I'm like, no, that's bearing down.
Yeah.
Right. So it took me by surprise. Like somebody and I've been with him for 5 years, you'd think somebody who'd been so well trained in so many areas and knows a lot about a lot still had misconceptions about his core, for starters. And 2, he was bulging. Only in that task though. So I guess one of the take homes of this tangent is you can be a man and have a diastasis, but the bulge was task specific. It was only in his reverse crunches. His planks, his lifts, whatever it may be, weren't apparent. So I'm going to challenge you, those listening, not Dr. Katrina. I'm going to challenge you, keep an eye out for when you see a bit of that bulge or in those tasks that you find you're a bit weaker, because those do help us clinically help progress you. Right? If I know you can't do this task very well, but you achieve this one very well, and we got to bridge that gap somewhere.
No, right? And like, thanks for sharing that story, because I think a lot of people think that turning on the core is that bearing down, pushing your bowel movement, is that expansion. Because when you take a deep belly breath, you're kind of like pushing out. You think that that's like, oh, my core is on, I'm supposed to belly breathe, but it's actually when you exhale and you're kind of tightening and pulling in, and that's going to be what's going to be most beneficial. Sounds like for your boyfriend, but postpartum, but even for myself, when I do go through any exercise, like the dead bug, the bird dog, any of these exercises that we think of conventionally for low back pain or.
And I guess we'll finish on this point, but I believe from what I saw, the reason why he thought of it as a bearing down and less of an engaging is because in heavy lifting scenarios, let's say you're looking at a deadlift, I don't know, I don't even think I could lift 195 pounds. So let's just assume I'm trying to lift 195 pounds off the ground. There is no way that I can exhale through the beginning of that movement. I will brace, lift, and exhale at the top. So if he had said, well, it's like bracing, I'm like, yeah, kind of, but not really. So he extrapolated bracing to bearing down. I'm like, no. Let's rework this. And now he does his reverse crunches without a bulge.
Yeah, because that's not lifting 195 pounds. You're doing like a deadlift or something. So it's a reverse crunch. Anything body weight, you should be able to kind of follow these cues. And that's an important thing too, is you have different tools and like, I have exercise bands and things that people can use at home, but majority of these exercises can be done with your body weight. So you don't need all this equipment and everything. So just need to speak to someone, get an assessment, even if it's virtual, and we'll guide you and give you the tools and education so that you can get started.
Correct.
Excellent. Okay, well, thank you so much, Anik, for coming on with me and again talking about pregnancy, postpartum. It's been really exciting to learn, not just from my own readings, but from other professionals in this time. One of the kind of caveats or nice things. I've tagged Anik in her page. She's got a new website there that you can read a little bit more about her locations, contact her, but also if you have any questions, feel free to contact me. And yeah, so it's Thursday. It's a beautiful day. I'll let you get back out to your gardening and
I think it's looking like barbecue and a beer soon.
yeah.
Oh boy.
Alrighty. Well, message us if anything, guys, but I'll stop the live for now and talk to you all later.
Have a good one. Thank you.